The shoulder is a ball and socket joint, where the head of the humerus fits into the shallow socket of the labrum. Injury can occur through trauma, such as a fall on an outstretched arm or a direct blow to the shoulder, as well as through repetitive overhead movements common in sports like baseball, tennis, and swimming. These injuries may result in labral tears, leading to instability and recurrent dislocations of the shoulder. Bankart repair is often done for individuals who have experienced shoulder instability and want to prevent future issues while regaining function. Advance the trocar tip obturator through the guide and tap it to create a pilot hole. Remove the trocar while leaving the guide in place. Use a 1.8 mm drill bit through the guide and stop when stopper reach the drill guide. Remove the drill bit while leaving the guide in place. Insert the 1.8 mm Auxpik anchor through the guide and tap it in until the driver handle touches the guide. Pull the round cap to release the suture. Pull the sutures to deploy the anchor under the cortex of the bone and confirm the fixation by pulling the sutures. Use the smart hook suture passer underneath the labrum to bifurcate the suture in different openings. Use a suture retriever to retrieve the suture in the same cannula. Use a sliding knot technique with knot pusher to tie and reduce the lesion. Cut off excess suture. Repeat for each anchor to restore the labrum. The Auxpik anchor is available in 1.8 mm with various combinations of bio-braid and suture tapes, providing a small footprint and subcortical fixation for anchor insertions. After a Bankart repair, the priority is healing the repaired labrum. Patients wear a sling for 4 to 6 weeks, with early passive motion to maintain mobility while safeguarding the repair. Recovery begins the moment surgery ends. Clear post-op guidance ensures a safe, progressive recovery toward full function. With Auxein's precise fixation and next-level care, patients move confidently toward restored shoulder stability.